Well, let's start with price transparency. So the price transparency rules out there, they're supposed to have their shoppable services pricing published at this point. It was interesting because that was a question that came up in a lot of the Q&As. And most people said, yeah, we're compliant. Others may not have been compliant. They sort of walked around the question. But the question is, does this really lead to price transparency? Does putting your shoppable services out there really lead to it?
So again, back to this balkanization, this absolutely is going to impact price eventually. And what I mean by that is, this isn't a tool that's going to be easy to use for a consumer, but if I'm a competing insurer and if I'm an employer, I'm either scouring through those records or I'm hiring a third party to help me find these kind of nuggets of gold in those 70 shoppable services that are required to be disclosed. So it's, first, they're not easy to find. I mean, I've been doing some searches trying to find them for different systems. So it might have been helpful. And so, for CMS, a lot of criticism, but for me, it's a good first step. It's not perfect, but it's going to lead to something better. I would have had some standardization about where on your website you had to place this and maybe what kind of a user format. But eventually, there are some smart people that are going to find the data on these 70 shoppable services that are required and start really analyzing them for what I'll call this irrational pricing. And it's out there. There's significant variation. So if I'm an employer, I'm pointing out other places in my market that I have a significant price discrepancy. So it's going to lead, inevitably, it has to lead, transparency leads to lower prices. It just does. But if that gets back to the point where if it's a commodity, the prices should go down. And I think the opportunity, though, Bill, is if you truly have a premium service and you've differentiated yourself, and it may be initially by reputation, but ultimately it's by patient satisfaction, it's by outcomes, there's no reason you can't charge more for that premium service. And right. So it may sound like it's going against the grain, but it isn't about just lowering the prices. It's about getting rational prices, because if something actually costs more justifiably and it's a premium, you should pay more for it. And so this is hopefully a bit of a plug in terms of cost management, cost accounting, the work I'm doing with Health Catalyst and Chorus. It actually matters which service lines are profitable and which individual procedures are profitable and which physicians are profitable. And until you actually know that honestly with accurate data, you don't really care about cost if you have irrational pricing. Now that we're going to have eventually rational pricing, you need to have rational costs. But where you do have higher costs and they're justifiable, so if you want to have cardiac procedures at the Cleveland Clinic, that should be a premium. Or you want to get cancer treatment at the Hillman Center at UPMC, that's a premium. Or neurosurgery at Mayo. But to get imaging or labs, or I'd even say total knee replacement, is that still a premium service? They become shoppable. You can go to many places to get these services done with the same quality and outcomes. And so I think that's where we're headed. It's early, but this price transparency, it's sort of the first crack in the dam. But I think what you're going to see over the coming year and years will be more disclosure, more transparency. And once these brokers and insurers and employers get a hold of this data, it's going to lead to lower prices for providers, no doubt.